what are some of the infertility tests that are available?
There's a barrage of tests that are available. What we normally want to do is, once we do the initial evaluation of both the man and the woman, would be then direct what tests are best to be done. For the ladies, we normally would sometimes do a test to confirm they are actually ovulating, despite having regular periods. Would then go ahead and check whether the tubes are actually open or blocked, and then do a scan that tells us whether the uterus looks normal, and if there's anything else within the pelvis that can interfere with conception.
Right, and
for the,
yes,
okay, yeah,
go
and
ahead.
then for the men, as I said already, basic sperm test. If the sperm tests are normal, period, they don't need another test. However, if the sperms were abnormal, then men can also have a hormone test done to work out why, and sometimes also imaging of the testes.
Right. Take us through the treatment options that are available for this problem.
Now, the first thing to work out is, does the couple require any treatment? If they're very young, well below 30, they haven't tried for more than a year, then it's worthwhile waiting slightly longer to either reach about a year, or sometimes even 1.5 years to 2 years. However, when you work out that there is something that needs to be treated, then what must be directed is what kind of treatment is required. For women where ovulation is not happening, all we need to do is give them tablets that enhance ovulation, and we expect that conception will happen somewhere between 3 to 6 months. If the tubes were blocked, then what we need to work out is it something we can correct by a surgical procedure, which usually doesn't work very well, or do they require what we call IVF, what is called as test tube babies? Because that's the only way to address tubes that cannot really be repaired. For sperm problems, mild problems with sperms, like mild abnormalities, usually will self-correct by changing lifestyle. Men who are overweight just need to try and lose a bit of weight. So saying about men, if they're just mild changes on the sperms, so if there's adjustment of lifestyle, then that could change to normal. That means those who are overweight could be more physically active, and then their sperms numbers could be better. Smokers, if they stop smoking, then their sperm numbers tend to improve. Things like Mira, other recreational drugs are also very toxic to sperms. So doing small things in lifestyle can help change the sperm numbers. However, if there's very severe sperm abnormalities and doesn't appear to be anything corrective to be done, then the only way out is for them to have advanced fertility treatment, which involves IVF.
How do you keep the sperm count up?
Now, what we know, men who are young and healthy are likely to have normal sperm counts. Men who are older, usually beyond the mid-40s and above, the sperm count will start to decline. Men who are overweight are likely to have abnormal sperms. Men who smoke, men who use other recreational drugs, and men who are not physically fit as well, and men who might have problems with sexual function. So all these things are pointers to problems with sperms, and such men should have a test sooner than later.
All right.